Welcome to the Chris Davis Show. I'm your host, Chris Davis, and today we're going to be talking about the American Health Care Act. In particular, we're going to be talking about why the GOP, the Grand Old Party, has failed twice to repeal the Affordable Care Act, commonly known as Obamacare. Last month in March they tried, and they failed. They tried again today, and they failed. So we're going to talk about why they're just not able to repeal the Affordable Care Act. To really talk about why they're not able to, let's just compare and contrast the two laws. Um, we're going to compare the Affordable Care Act to the American Health Care Act. So when we talk about the American Health Care Act, we're going to talk about what it was a month ago, and we're going to talk about what it was today when it was getting passed in the on the floor of Congress, because the second time they did a revision, and the revision let it gain more favor with the Tea Party, but it lost support from conservatives. So we're going to talk about the American Health Care Act, what it was a month ago, and what the revision was today. Alright, so let's look at the Affordable Care Act first. Alright, I don't have time to name every popular thing about the Affordable Care Act. I'm just going to mention the notable things about it. So it starts off with every U.S. citizen and legal resident must have health insurance or they pay a financial penalty. Alright, that's the first part. The other parts to it that's very popular is that insurance companies cannot discriminate against anyone with pre-existing conditions. Um, Citizens can keep their dependents on their health insurance plan until their 26th birthday. Employers with 50 or more full-time employees must provide health coverage. Insurance plans and the individual or small group market must provide core healthcare benefits, 10 of them. Cost sharing subsidies for citizens whose income is below the poverty level. And the Affordable Care Act is funded by an income-based system. So people with higher income pay more. So those are the very popular things about the Affordable Care Act. Now let's talk about the American Health Care Act a month ago. We'll get to the revision later, but let's talk about what it was a month ago. So the American Health Care Act a month ago, one thing that it kept was there's no discrimination against pre-existing conditions. However, it drastically changed by getting rid of the mandates. So that meant that employers didn't have to provide health coverage. Um, it also was going to let the states decide what regulations to impose are on the health insurance companies in their state. It was going to give them the option to decide which regulations to impose on them. So that would mean with the core benefits, they could decide which of them to cover and which ones not to cover. Okay, and it was going to get rid of the income-based system with a flat tax system that would have older Americans eventually paying more. Um, that's a huge problem because elderly people or older people are more likely to have health problems. So that plan was going to have them pay more for health insurance. Okay, so a month ago in March, when they tried to get this bill passed, it didn't have conservative support, it didn't have Tea Party support because the benefits were still too good for the Tea Party. All right, but this time in April, like today, when they try to pass it, they did a revision, allowing states to opt um, allowing states to opt out of pre-existing conditions and the core benefits. So states could decide whether to discriminate against people with pre-existing conditions. they'd still be covered, but I believe they would have to pay more if they had a pre-existing condition. And again, they could decide which of the core benefits to cover. All right, so they did this revision. Also, I have to mention that part of the revision was that they could keep the old plan, which is the Affordable Care Act, and the American people can keep the American Health Care Act, which was very unpopular. People thought that was very hypocritical. All right, so they try to pass the plan. So it gained Tea Party support because it became more right, but it lost support from some moderate conservatives. All right, it's weird that um, it's weird that they thought it would even get passed because the first time it didn't get passed. What made them think that making it more far right or cutting off more benefits would make it like pass? But it didn't. It doesn't make any sense. If it didn't get passed the first time, what makes you think it was going to get passed the second time when you made it have less coverage in it? So it gained Tea Party support but lost more conservative support. So it was a double-edged sword. It didn't get passed. Um, so those are like the reasons. So it's just why they didn't get the bill passed in March and why they didn't get passed today. One thing that's consistent for why conservatives aren't able to like pass bills is that their party's divided. Yeah, they have more representation in the government, but that doesn't matter because like the party's divided. Um, they can't get their own like party to support bills or laws that they try to pass, whether this is because of constituents or resentment from Trump and his political campaign. But the GOP doesn't seem to be able to like pass bills right now. Um, like my thoughts are like, should they even bother replacing the Affordable Care Act? They were they were going to give us the American Health Care Act, but they were going to keep the Affordable Care Act to themselves. To me, it's hypocritical. But should they even bother replacing it now? They failed twice, and they can't even get other conservatives to back them up. At least not all of them, anyways. And we know for sure that independents and Democrats are going to oppose it. Um, so should they even bother like replacing the Affordable Care Act? Is it as bad as they claim? Um, I just think it's a really good bill. It does have flaws in it. The premiums they're bad, but in large part, it's a good bill. It's just when they've tried to pass their health care bill, it's not better. It's worse. It's just a big tax cut for like the billionaires and stuff. So the bill's not better. In fact, it's worse. Uh, so one thing I suggest is they could just work on fixing the premiums. All right, the premiums are a problem. They could fix the premiums. The premiums go up every year, so they could fix those. I bet you're wondering, why do the premiums keep going up every year? Well, part of it is just the Affordable Care Act itself. It states that all insurance companies must provide health coverage to everyone. They can't deny anybody. So that's going to make premiums go up. So that's one way they can fix it. All right, because they have to provide health coverage to everyone, the premiums are going to go up. Second is that premiums have been going up because of conservatives trying to sabotage the bill. They like to block funding for Medicaid. So when they block funding for Medicaid, that also increases the premiums. Another way premiums go up is that states that really support the Affordable Care Act, that allow the expansion of Medicaid, those companies pull out of those states because it's not profitable for them. Um, so when nearly all the insurance companies leave a state, and there's only one insurance company that people can get their coverage from, that raises the premiums because they have a monopoly and there's no competition. So to me, they should fix the premiums. That's been the biggest consistent problem with the Affordable Care Act. That's what I believe that the conservatives should work on the Democrats on fixing. All right, so let me know in the comments section below. Do you think they should repeal the Affordable Care Act? Do you think they shouldn't? I also have my sources in the description below. Have a great day.